pressure injuries. Question 1. Which client is at highest risk for development of pressure ulcers? So go ahead and pause the screen and try your best to answer this question in about 60 seconds or less. Now, following the question breakdown strategy. Number 1, we always look at the key terms in the question. So key term is highest risk and pressure ulcer, also known as pressure injury. And number 2, think of a few things you know about those key terms. So for pressure injury or ulcer, this is that skin breakdown. We know from the full video that the big risk factors, number 1 is being bedridden for a long time. And number 2 is incontinence, followed by poor nutrition, diabetic neuropathy, and liver cirrhosis, resulting in that low albumin. So now let's look at the options. Option A, a 65-year-old female client scheduled for an elective hysterectomy. No, this is incorrect. This client has chosen this elective surgery to remove her uterus. It sounds like she's lower risk since she can make her own decisions here. But let's look at the other options. So option B, a 55-year-old male client who experienced a heart attack with an order for bed rest. Ooh, this is close, but probably incorrect here. Because ordered bed rest after a heart attack, we can assume that the client was active before. But again, let's look at the other options. Now, option C, an obese 70-year-old female client diagnosed with hyperglycemic hyperosmolar non-ketosis. Woohoo! Big long word for HHNS, that type 2 diabetic problem. Now, this option was pretty tricky. Sure, the client is obese, they're 70 years old, and in a diabetic crisis. But option D is the most at risk. So option D is the most correct. So let's break it down. An 80-year-old thin male client with low albumin who is confused to person, place, and time. Yes, this is the most correct because look at the key terms here. We have a thin, old client who is the oldest out of all the options. He has low albumin and confused. So this client is likely to be bedridden with possibly having incontinence with poor feeding due to the confusion. So option D would have the most risk factors here. Now moving on to question number 2. The nurse performing an assessment on a newly admitted client notes a lesion on the client's right heel that appears as a shallow open ulcer with a pink wound bed. The nurse will document this as a fill in the blank. So go ahead and pause the screen and try your best to answer this question. All right, let's break this question down. Following the question breakdown strategy. So number 1, first look at the key terms in the question. Question states lesions on the right heel, shallow opening, big key term is open, with a pink wound bed. So think of a few things you know about those key terms. Well, we know that stage 1 is a closed pressure injury. Stage 3, on the other hand, is deep into the subcutaneous, looking kind of like bubble wrap, which is not the case here, so it must be stage 2. So option B would be the most correct, as it is shallow, open, with a pink wound bed. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz. This is an autoimmune disorder where the body attacks normal healthy tissue, causing rapid cell division in epidermal cells, the skin cells, resulting in some very key signs and symptoms. So write these down. Silver plaques and reddening skin. These skin plaques present as rough with raised flat tops, typically found on the scalp and the creases of the body, like the knees, elbows, and even buttocks. So Hesse mentions plaque psoriasis. The nurse would expect to see which type of lesion? Elevated lesion with rough, flat top that is greater than 1 centimeter in diameter. And a second question, plaque psoriasis. The patient demonstrates an understanding of the disease by stating that the symptoms are caused by which change in normal skin? Rapid cell division. Now, in terms of the causes and risk factors, a psoriasis flare-up or exacerbation is typically triggered by an irritant that heightens the body's immune system, making the body attack itself. So triggers include food allergens, trauma, and the three S's. S for stress, sickness, and even sepsis or infection. Not sun exposure. Many students get this wrong. This actually helps to slow the turnover of skin cells and limit the flare-ups. So remember, not sun exposure. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download. Now for skin cancer. This is uncontrolled growth of cells within the skin, and we have various types. So basal cell carcinoma is the most common, but it's slow growing and rarely spreads. Squamous cell carcinoma is the second most common, and Kaposi sarcoma, which is a huge NCLEX tip. Write this one down. We see patches or lesions of abnormal tissue growth that look like purple, red, or brown skin blotches. So just know these key terms here. And the last one is melanoma, which is the deadliest form of skin cancer, since it spreads very quickly, involving moles. So we call it molenoma for melanoma. Now Saunders mentions, a client diagnosed with melanoma, which statement by a client indicates that education was effective. It is highly metastatic. Now to define some terms, a mole is called a nevy, and a tumor is called a neoplasm that develops if there is a DNA mutation. Now some tumors can remain benign and stay well contained, while some become malignant and very deadly. So the memory tricks, just think benign is like be nice, it's non-deadly. And malignant is very malicious, very, very deadly. So be sure to write that down. Now metastasis or metastasis means that the cancer is spread to other locations in the body, as mentioned before. Like when a malignant tumor gets inside the nearby blood or lymph vessels, it can travel from the primary site to the secondary site elsewhere. Now, in terms of signs and symptoms, screening for skin lesions is the biggest key point. The key here is prevention, so we must educate clients to be vigilant on screen lesions. Anything that is changing in size, color, or dimension is bad, and typically means that it's malignant or deadly. So the A, B, C, and D are the biggest NCLEX tips for screening. So write this down. A for asymmetry. Just think irregular is bad, or think irregular is not regular. Something is wrong here. So a half raised or half flat that is not round, then we have asymmetry. So the key terms here, half raised and half flat. This is bad. Now B is for border irregularity. Remember, irregular is the key term, with uneven edges. So write that down. C is for color variation and changes. We do not want a mix. So a mix of brown, tan, black, and even red, or the worst here, a black or dark lesion, are typically indicating of necrosis. Not a good sign. And D is for diameter, anything over 6 millimeters. Commonly described on many question banks as lesion is the size of a coin or a nickel. So just think the size of a nickel is over 6 millimeters. And lastly, E is for evolving, changing in size, shape, and color. Remember, any type of change in size, dimension, color is a bad thing. So write these down and focus on the highlighted ones here because these key terms came up a lot on the NCLEX. Now another big NCLEX tip is the key terms, irregular or uneven growth. Remember, this is bad. And even change. A lot of question banks use the key terms abrupt, sudden, or rapid when describing color, size, and shape. All these key terms indicate that it's bad for the lesion. So teach clients to report to the HCP for a follow-up immediately. This could mean deadly malignancy. Now, a little side note here. A full workup for every single mole is not necessary. Only the ones that are changing or have uneven growth or irregular growth here. So Hesse mentions, the nurse notes widespread nevy across the body. Which characteristic, if demonstrated by one of the nevi, would cause the nurse to be concerned about malignancy? Irregular border. Yes, we want a round border. Anything that is irregularly shaped is bad. Now, in terms of diagnostics, a tissue biopsy is required to make a definite diagnosis of skin cancer. But again, the key term here is that all new growths and pigmentation do not need to be biopsied to rule out cancer. Only the ones that show irregular changes, as mentioned before. Now, for the causes and risk factors, we have environmental or genetics. So for environmental, the big NCLEX tip is exposure to UV light. Now, this is the most tested since it's the most common. So we want to avoid tanning beds. Write that one down. Like the old Jersey Shore TV show here. Gym, tan, and laundry. No. No tan, just the gym and the laundry. Now, sun exposure is another key term. So write this down. Frequent sunburns as well as an outdoor occupation. Huge risk for skin cancer. Now for genetics, the NCLEX tips that we highlighted below, I'd write these down. Family history of skin cancer, like a father or mother with melanoma, and even Caucasians with light skin, blonde hair, and freckles, due to the fair skin that is more easily burned. And a high number of moles. This indicates a big risk for skin cancer. And lastly, the use of immunosuppressant medications, like HIV medications and long-term anti-transplant drugs, which lowers the body's ability to defend against cancer. So I suggest pausing the screen and writing down the highlighted ones here, as these are the most tested out of 5 different textbooks. So Hesse had a question: what would the nurse advise a patient to avoid to minimize the risk of skin cancer? Tanning beds. Yes, we want to avoid the tanning beds. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download. Fungal infections is the next topic here. Also called tinea or tinea, or even Tanya. I'm just kidding, not Tanya, just tinea. Anytime you see the word tinea, just think fungal infections. The most commonly seen is tinea corpus, that ringworm infection, as well as tinea pedis, basically athlete's foot infection. Both are very contagious fungal infections that live on the surfaces of skin. So Hesse mentions tinea capitis, tinea corposus, and tinea pedis. All the tineas are examples of which type of infection. So remember, tinea, just think fungal infection. Now for signs and symptoms, we have a circular rash that looks scaly and even itchy, also known as pruritus. So Hesse mentions a patch of skin that itches on the right forearm, a well-defined circular rash with a red border and clear center. The nurse anticipates a diagnosis of which skin disorder? Tinea corposus. And a second question. A patient with tinea pedis, that fungal infection of athlete's foot, has increased moisture and pruritus around the toes, that itchiness. Which instructions does the nurse give? Select all that apply. So write these down. Wear cotton socks to absorb moisture. Use warm water soaks for the toes. Keep the toes clean and dry. And soak the toes in Burow's solution to help with this fungal infection. Now for education, the biggest piece of advice is not to spread the infection. So those who have the infection can easily spread this via direct contact with humans or even animals. So the big key point and priority for any type of tinea, especially tinea corposus, that ringworm, write it down. Most important to teach ways to prevent the spread. Ringworm is easily spread and highly tested on. So we must educate clients not to share personal items like brushes, towels, hats, clothes, or really even anything else. And we always wash all the bedding and sheets before infecting another person in the family. All right, that wraps it up. Thank you so much for watching.